Hi, Dr. Emily Kirby here, board certified plastic surgeon. So I get a lot of questions about a mini tummy tuck, right? And when we talk about a mini tummy tuck, the incision is shorter than a full tummy tuck. And who wouldn't want that, right? Well, it's important to think about several key features that make someone a good candidate for a mini tummy tuck. Number one, I look at the upper abdominal wall. When I look at a person who might be a good candidate for a mini tummy tuck, they've got an upper abdominal wall above the belly button that has great muscles. They're well defined, they're not separated at all, and really the upper part needs nothing from me. Number two, I look at the belly button. The good candidate for a mini tummy tuck might have a belly button that's a little bit higher than normal, and it might be not a lot of excess tissue around the belly button. A good way to mimic that is if I pull on the bottom of the abdomen, mimicking removing tissue, and I watch that belly button. If it turns really far south, some people call it Mr. Sad Face, when they see Mr. Sad Face there, I don't want to leave a belly button like that. It doesn't look good. Nobody wants that. So we have to pay attention to what the belly button looks like if I pull tissue down below. We'll come back to that. And number three, I want to make sure that this patient does not have a significant amount of tissue to remove. I call that skin math. Right? If I'm making an incision that I'm going to promise you is very short, then I can only remove about this much tissue. If you've got a lot of tissue that you want me to remove, I have to make that incision longer. If I try to take this much tissue out and only promise you this long of an incision, then you're going to have big bunching and gathering and puckering at the sides of that, and that doesn't look good either. So this is where it was very important to see a board certified plastic surgeon who knows and has experience with examining these things. So coming back to the belly button, with a full tummy tuck, you keep your same belly button, and it just comes up through a new opening in the skin. With a mini tummy tuck, we have a variety of things that we can do. One of the more common techniques is called floating the belly button. If you have a belly button that's naturally a little bit high, we can float the belly button by removing it from where it attaches to you, letting it float down 1 or 2 inches, and then we reattach it. And then we remove that little bit of excess at the bottom. And again, that would be an ideal patient who doesn't have a lot of tissue to remove. With a full tummy tuck, the incision is longer. We keep it as low as possible, curving up on the sides a little bit to mimic bikinis, swimsuits, things like that. And the idea is that it stays low and that it heals beautifully. We talk about all sorts of different things that help you to heal that scar as beautifully as possible. We hide scars wherever we can. With the belly button scar, we hide it in shadows wherever we can, making sure that the scar is pulled in as much as possible, because you don't have to have visible tummy tuck scars.